Hi, my name is Julia. I'm an international student from the Netherlands and studying at the University of Limerick at the moment. I'm following a course of normal and clinical psychology, and today I'm going to share a part of this interesting knowledge with you. So, take a nice cup of tea, sit down and relax, because this video will explain a very serious mental disorder, obsessive compulsive disorder, named OCD. OCD is one of the 6 anxiety disorders and characterized by obsessions and compulsions. Obsessions are intrusive, inappropriate, and persistent. There are different forms of an obsession. It can be an unwanted thought, for example that your best friend is going to die, it can be an impulse, that you want to kill your mom, or it can be an image, that you see your neighbor naked. The person recognizes that the thoughts are product of their own mind and feels that the obsession is not within his or her control. Compulsions are repetitive actions or behaviors in order to reduce stress or prevent a negative outcome. A person suffering from OCD reduces most of the time the feeling of anxiety or distress with the performance of a compulsion. However, the feeling is not always reduced and sometimes increased by the performance. Important to know is that there is no realistic connection between this performance and the target. The performance can be very random. Examples are washing and cleaning rituals or checking 5 times if the door is closed. Lifetime prevalence is around 3% and prevalence in men and women is the same. The age of onset is variable, but mostly late adolescence or early 20s. Factors that can influence the onset are stress, life changes, or responsibility increase. The cognitive approach to OCD is about the control of thought. We almost all experience unwanted intrusive thoughts in our life. Thoughts as driving a car off the road, for example, but we can reject these thoughts. However, in case of OCD, it is not possible to ignore the thoughts, and the patient experiences the thought as meaningful and feels a high responsibility. This experience can be very distressing, and the patient tries to prevent a negative outcome by showing the compulsive behavior. This can be explained by a thought suppression theory, derived from the classic white bear experiment. When I show you this picture of the white bear and ask you to think about anything but not of the white bear, there is a major chance that you will think of the white bear. You will search for thoughts that are not associated with the white bear, but during this search the exact opposite happens. More and more thoughts will become associated with the white bear. So when an OCD patient tries to suppress and avoid the thoughts, will just end up thinking more about those thoughts. A study that is done by Amir, Kashman et al. In 1997 analyzed different thought control strategies used by OCDs in comparison to controls. They analyzed 5 different types of thought control strategies used when a person was exposed to an intrusive thought. The strategies of thought control are distraction, I do something that I enjoy; punishment, I get angry at myself for having the thought; worry, I dwell on other worries; reappraisal, I analyze the thought rationally; or social, I ask my friends if they have similar thoughts. The study shows that individuals with OCD use thought suppression strategies indeed more frequently than non-anxious people do. And this graph shows that the frequency of thought control strategies used is much higher in OCD patients than in the controls. Except for the first one, the strategy distraction is less used by OCD patients. The cognitive approach is used for the treatment of OCD. Dealing with OCD can be very hard and time-consuming. The aim of the cognitive behavior therapy is to help the patient to step outside their worries. The therapist can help an OCD patient to find alternative and more helpful explanations for their thoughts, which are less threatening and will avoid the obsessive behavior.
Created using Powtoon.